Dear friends, hello. I am Dr. Ganesh Mathan, Senior Cardiologist from Omega Hospitals, Gachibowli, Hyderabad. Today we are going to speak about coronary angiogram. There is a myth stating that coronary angiogram, if you do, the person becomes weak. The person's heart becomes weak. Or they have a chronic pain in their arms and the legs through which the coronary angiogram has done. It is wrong. The 100% safest test on earth, if I have to say, I can rate coronary angiogram also one among them. The patient is in the cath lab, and this is the place where the person would like to have any kind of a complication, because instantly everything is ready and the patient is saved. Coronary angiogram does not have, it has 0% complication as of the current standard, with the contrast what we have, the quality of contrast and the kind of equipment. So please do not fear coronary angiogram is point number one. After coronary angiogram, we need to take 3 days rest and they may get fever, these things. That is also wrong. Patient can drive a scooter or motorbike post angiogram within 1 hour and go to his office, or maybe travel for 50 kilometers to his house. There is absolutely no issue of tiredness or fatigue. Fever, yes, 0.1% could be a reason, could be a possibility. But it is one of the safest tests. Third point, people ask, why should I undergo coronary angio? Why can't I? What is the advantage of coronary angiogram over CT coronary angiogram? I would say CT coronary angiogram is a fantastic tool for absolutely healthy, asymptomatic individuals who want to know their heart. But in a general population where there are a lot of cardiac patients who have significant amount of blocks, and there is a mix of normal people, definitely CT coronary angiogram does not overscore above the conventional angiogram. Conventional angiogram is 100% gold standard test for evaluating the coronary anatomy. The advantage I see in conventional angiogram versus CT coronary angiogram is one. The only thing that can cause some problem in the patient who undergoes an CT or in coronary is the contrast, the chemical, the dye what we inject. For a CT coronary angiogram, because you are injecting in the vein, the vein, we have to inject around 75 to 100 ml, huge amount of contrast into the vein, which goes into the circulation, and as it passes through the heart, that time the CT scanner picks up the picture and then we examine the result. But conventional angiogram, because we do it from the arm, the wrist, or maybe from the thighs, through the tube is going into the heart here. We need to inject just 5 to 15 ml of contrast, by which we can have 100% evaluation of the coronaries. So chemical load for the test is significantly lower in a conventional angiogram versus CT coronary angiogram. Third, CT coronary angiogram is a picture, it's a photo. Conventional coronary angiogram is a video. So guys, which would give better detailing of the vessels, the anatomy, the bends, the flow, the blood viscosity, everything? Definitely a movie. So when I take a picture of a car in the road, it shows that it is in the moving, but we don't know at what pace it is moving. But the video will give us a clear picture. So videos are better than pictures. Then normal angiogram is better than CT coronary angiogram. So do not fear about either of these tests. These two tests have been performed for the past 20 years. They have been proven to be absolutely 100% safe. But yes, if you are an elderly person who is a diabetic, long-standing diabetic, you have some kind of significant symptoms of the heart, or you have a strong family history of cardiac diseases, please consult a doctor and go for the appropriate test, which would be conventional angiogram, not an CT coronary angiogram. Thank you very much.